Our next department is Department of Human Services. Is that cheer from the Health Commissioner leaving or Human Services coming in?
No, it was for DHS.
We're not sure about that.
It was for DHS.
Or is that the Commissioner of Health cheering that he was leaving? I don't know.
That was me cheering and you introducing it.
Okay. And if we could ask everybody that is joyously leaving to please keep your voices down because we want to get right in the next department. Good afternoon, Commissioner. Please proceed.
Good afternoon, President Clark and members of the City Council. My name is Cynthia Figueroa, and I'm the Commissioner of the City's Philadelphia Department of Human Services. With me today is Kimberly Ali, Deputy Commissioner for Child Welfare Operations, and Christopher Simi, Deputy Commissioner for the Department of Human Services Finance and Contracts, as well as other members of my senior leadership team. Thank you for allowing me to testify today. It has been a very busy year for DHS, and we're very excited to provide some highlights of our year. We've received a full license from the Pennsylvania Department of Human Services, and I'm very pleased to announce that we just received the renewal. The Child Welfare Group completed an independent audit of the Improving Outcomes for Children's initiative. It reviewed both DHS and the community umbrella agencies and confirmed that the CUA model is the right model for Philadelphia. The community umbrella agency scorecard, the baseline year data, was released. We are proud of this work not only because of its methodologically sound accountability tool, but it also is unprecedented in its transparency. The scorecard shows improvements are needed. Importantly, the scorecard provided CUAs with a roadmap to pinpoint the areas that they need improvement. We are pleased to report that no CUA measured at critical. The scorecard process is working to improve quality. We just completed a 6-month analysis, and the early results are promising. We know that 3 CUAs have moved to 4 bells, and 6 are at 3 bells, and only 1 remains at 2 bells. Case manager retention at the CUAs has improved significantly. This has moved from 56% to 97% over the last year, and caseloads have decreased. We've also enhanced our support to foster care parents, including an increase to the amount paid to foster care and kinship care providers. Last year, with support, we also ended child support for delinquency. We believe this move better supports the families we serve. We continue to work with the police school diversion program, where we've diverted 372 youth. DHS continues its commitment to diversity. At the CUAs, minority and female membership at all levels of the organization have remained stable. The executive leadership is 43% minority and 63% female. For DHS, 81% of the new hires in fiscal year 2008 have been minority employees and 70% are female. Most significantly is that improving outcomes for children is meeting its goal of keeping children in their homes and in their communities, timely reunification, a reduction in congregate care, and improving child functioning. We have seen significant improvements in all of these areas. 46% of children who are in placement live with a family member in kinship foster homes. When we look at home-based care, this number is 55%. 57% of youth in foster care live within 5 miles of their home, and 82% live within 10 miles of their home. 12% of children live in congregate care settings, and this is compared to 21.6% before improving outcomes for children. Amid all this great news, we know that there are still challenges that we have to address. We continue to have a high rate of children in out-of-home care, and our strategy to reduce this includes work on both ends. We have to work to timely and movement to permanency. We're working to decrease the number of children in placement by looking at the front door. That means that we're added additional field screening units where DHS workers provide another level of assessment. Second, we're addressing the challenges with adoption. We are working with the Casey family programs to complete a full and detailed assessment of our adoption process. We've also implemented the rapid permanency reviews for children and youth whose cases are not progressing to permanency. Our work to address child welfare and juvenile justice for the kids in Philadelphia is amazingly complex and challenging. The process to stabilizing families is a difficult one. This is why we must continue to work together in order to achieve our goals. We accomplish more together. I would like to take a brief moment personally to thank the incredible staff of DHS who commit to keeping children safe, our CUA partners, our resource families, and the providers who work every day to protect children. Please recognize the staff and our partners.
Thank you. Thank you very much.
I look forward to working with council, and I now welcome any questions related to our budget.
Thank you, Commissioner. Thank you for all the work you and the whole office does.
Thank you.
In your written testimony, you talk about the increased funding to foster parents.
Yes.
Do you have any statistics on how our funding compares to other municipalities?
So I can have our Deputy Finance Commissioner talk about it because we did look at comparables, but
Okay.
what I can say is that when we chose to increase, it had been over a decade since we had increased what our per diem rate was for foster parents.
So this is the first time you've done that?
First time in at least
10 years?
At least 10 years.
Wow, okay. All right. Please
Yes.
identify yourself. Yes.
My name is Christopher Simi, Deputy Commissioner for Finance. It's a good question. We are generally a little bit high compared to other cities. We did a survey about a year ago when we were costing this out, but the number we arrived at was actually based on a sort of a study of the actual cost of raising a child in this region.
Mm-hmm. Okay. Thank you for that. The school district, I know, has ramped up, and this is kind of both for you and behavioral health, I guess, behavioral health services in schools. Do you interact with the school district that the children going through the DHS system, are the needs are provided? Yeah.
Yes, so we are pleased to report that we have actually a very sophisticated and long-standing relationship with both the School District of Philadelphia and Community Behavioral Health, so much so that we dedicated an entire unit at DHS. So we have what's called the Education Support Center, and that entire unit is, well, not the entire unit, but a good portion of that unit is actually housed at a 440, and when we work really on a daily basis with the school district, and then we have staff members of that unit that work in district-run schools.
Okay, great, thanks. My last question. I know you do detail a number, I think it has 226 vacancies in your department. Can you comment on that, what the plan is to try to fill those?
Yeah, sure. Again, Chris Simi, Deputy for Finance. This was a question that definitely came up last year in our hearings, and it's something that
I remember that, yeah.
And based on some of that feedback, it really pushed us to take a close look at our positions as we prepared the fiscal 19 budget. So one of the things we did is we looked at positions across the department and tried to figure out which ones were really necessary and which ones maybe we didn't need as much. And so we identified 24 positions that have been taken out of the budget. That doesn't address the vacancies which you're referring to. So there's about the 236 that you mentioned that show in the budget document, so I can put a bit of context around that for you. The first is that at any given time, we expect about 100 positions across the department just to be vacant through turnover, so like people retiring, getting promoted, moving to other departments. We call that sort of our natural vacancy rate, and so we don't actually fund those 100 positions. And that leaves about 130 vacancies that we think of really the ones that we're actively trying to fill. And in the document you see that shows a run that was done in November. So since November, we've actually brought on an additional 36 people. So that knocks that number close to about 100. And looking forward, I think I believe May and July, we have 2 large hires coming up for youth detention counselors and social workers, which we expect to bring on between 30 and 40 new people. So that should get the number
down around 70 or so.
Yeah, much further down, at least by the end of the first quarter of fiscal 19.
Okay. All right. I appreciate that answer. Thank you. Councilwoman Reynolds Brown.
Yes. Good afternoon, DHS.
Good
Thank
afternoon.
you for the meeting earlier this year to give us a more detailed update on your progress and where you are, particularly around MBE, WBE participation and numbers. Speak, if you will, for a moment on how, let me not answer the question, how you're doing with regards to the boards of CUAs. one, and two, with regards to the spend by CUAs with MBE-WBEs.
Sure. So, as you know, Councilwoman, thanks to your leadership, this is something that we've paid very close attention to, and we're very pleased with the progress. As of right now, the CUA board members represent, when you do a totality of the 10 geographic regions, 41% are minority in the board and 39% are female. In regards to the minority spend related to the CUAs, we've increased from 5% in 2015 to 24% in the current year. So we've seen continued progress, movement in the right direction.
As a result of intentional effort directed by leadership, because that's the only way that happens.
I agree
If
with
leadership
that.
doesn't get it or believe in it, it's not going to happen organically. That's my soapbox.
Yes, and as you know, we've drilled that down even further so that there's the CUA board as well as the CUA leadership. I mentioned in my verbal testimony that the CUA leadership has changed significantly. It's 43% minority and 63% female.
Okay. I am concerned about young people who enter the system and do not find their way to a pre-college experience that leads them to college, the college pathway or pipeline as an option. I'm increasingly concerned about that. So are there any efforts, initiatives, programs in place that when young people enter foster care in particular, that they are linked up with or tracked, or because there are many young people in foster care who have enormous potential for the college experience if directed to do that. So if you could share if that's ever been a part of your programming or consideration for going forward, and or if you have relationships with partners who are in the business of directing young people into those pre-college experiences.
So I will let you know what we're doing, but I think this is an area we can always continue to do better, just given what we want to see from our young people to succeed long term. So we have a unique program that has been operating for quite some time called the Achieving Independence Center.
Okay,
So
very familiar.
So our older youth are referred to the Achieving Independence Center. There are both job coaches as well as folks who are working on your test preparation, but also your applications to colleges, how to support around financial aid, and what all are the resources available to you. And so that's work that we do in partnership with Valley Youth House. So there is a very specific way that we try to focus our efforts through the Achieving Independence Center.
Is that still at 7th and Market?
It is actually now further in the community. It's on Broad Street.
Okay, so there's a professional there with the principal responsibility of holding young people's hands to get them in the pipeline?
Correct. There's actually more than one. So there's a handful of professionals with an emphasis and focus on working on post-secondary. And I'm sorry to interrupt, Councilwoman. Back to the question that was asked by Councilman Greenlee is that we also work very closely with the school district around if there's disruption, how do we make sure that we're working with children around their credits? Are they on track for graduation? And then are we supporting the post-secondary?
So that's a segue to my next question, and that is how well are we doing with the school district? We know in years past there have been hiccups and impediments and barriers to linking the system in a real way that holds on to young people so that they don't lose ground academically. So what has been the progress?
So while I recognize that certainly there's been a challenge, I believe both out of necessity and true grit, we have a really strong working relationship with the school district because that's a day-to-day interaction when we have the district. We have so many young people, of course, who are involved in the school district of Philadelphia, so we're in constant contact. Our work through the Education Support Center helps to alleviate some of the challenges that children who are faced. One of the statistics I shared earlier is that 82% now live within 10 miles of their home of origin. That has helped us remarkably with Dr. Height in terms of keeping children in their school of origin instead of having to transfer out, and less movement of a child from school to school we know is to the greatest advantage of them because we don't want them to lose time. So I would just say in terms of our department's experience is that we have a very close, very strong working relationship with the district. We also have an unprecedented data sharing agreement, so we look at data as it can support enhancements between that relationship.
Well, that is unprecedented because we never had data to look to or rely on in years past. To get to the Achievement Independence Center is 18 or older, correct? Is that accurate?
It's 14.
14 and older.
It's 14.
It's 14.
It used to be 16
Tell
years
them
of
who you
age. Hi, good afternoon. I'm Kimberly Ali. I'm Deputy Commissioner for Child Welfare Operations. Again, good afternoon. So previously, the age for young people to go to the AIC was 16 years of age or older. We reduced it to age 14 under the leadership of Vanessa Garrett Harley when she was commissioner at the department.
I see. And so back to my interest in the pre-college track, young people's imagination has to be captured before 16.
Yes.
And so for young people in foster care who are under 16, what's the best pathway for a member of this body to be in touch with foster care parents so that young people in that track can be invited to these kind of experiences?
So there's a few things that we've done recently and things that we want to augment further. One is that DHS is an investor in the Summer Work Ready.
Oh, really?
And yes, so we're one of the more significant investors in access to that. And what we've done is establish that our youth have to have a priority in accessing those Work Ready slots because we know work exposure can then lead to wanting to extend your career path, and whether that's college or career and technical. So what we did is we've worked very closely with Philadelphia Youth Network, and we've made arrangements to have informational settings at each one of the community umbrella agencies so that they're aware of the resources that are available to the children that are on their caseload. And so that's one meaningful way where we're really trying to be very intentional to make sure that a resource that's available to young people is accessible.
Okay.
I know that all council does very unique events, and we try to be responsive. So if there's any events you having coming up in the spring that you would like us to physically be at, we would be more than excited to be there.
Okay. I'm certainly going to follow up on that. This is not a concern, but it's an observation. While the commitment and philosophically the agreement is there at this level,
Yeah.
I'm not always sure that it translates down through the trenches of those who are up close and personal in the face of these young people. So my concern is that the message gets to young people and they are urged and sometimes pushed to attend, because if they aren't, they simply are not going to get there on their own.
I agree 100%, Councilwoman. I think one of our challenges is the city, not just DHS, has tremendous resources for young people, and we have to do every effort we can to make sure that it gets penetrated down at all levels.
A better job if we want to see foster care numbers go down.
Yes.
It was 4,000 when I came here, and it's now up to 6. Is 6 the number now?
6 is this number, yeah.
So that's a signal to me that we're still trying to figure this out, and we need to make it right and make it better.
Absolutely.
Thank you for your effort.
Thank you.
Thank you, Mr. Chairman.
Thank you, Councilwoman. Councilwoman Gimm, please.
Thank you very much, Mr. Chairman. Good afternoon.
Good afternoon.
So one of the questions that I know that DHS has been interested in, and I'm certainly interested in, is about the caseloads for our CUAs. So the recent scorecard indicated that DHS has a caseload standard of 10 families per caseworker for the CUAs. And the recent scorecard showed that none of the CUAs is at the 10 family per caseload. Now, I think we talked earlier that I was even concerned about the 10, in part because,
Right.
10 cases can include multiple individuals, and we want to see if there's not only just a cap of 10 cases, because we want to keep families together, but a maximum number of individuals, family-centered, who could be in there. But could you talk a little bit, because when none of our CUAs are at the 10 cases per worker, this is one of the main reasons why we're struggling, I believe, with quality. I think CUA number 10 is every single, it's at 100%, A1 is at 90%, but, I had a chance to visit one of the CUAs, and this was a central issue for them, that they're not able to reduce their caseload to a manageable amount to ensure the kind of quality that I think all of us want and our system needs and deserves.
So one of the commitments that was made both at a citywide level and the state was to fund at a 1 to 10 ratio. So the CUAs are in fact funded at a ratio of 1 to 10. You're right, we're not at 1 to 10. Our current average caseload for the CUAs is 11.2. So we're not far from the goal, but we certainly have been able to cross that threshold. One significant gain in this is that we are now at a retention rate. Part of the challenge was a year ago we had a 56% retention rate of CUA case managers within the CUAs. We're now at 97%, so my hope is that the more you retain staff, your efforts in terms of staffing up can be further solidified. So, and then we did take the homework assignment you gave us, and we've been looking to see whether or not there's any national best practices around how do you manage caps. This is a conversation that we had with CUA leadership and asked them about how do you currently manage that, how do you best do that independently. One of the back and forths that we have is how do we support CUAs to have flexibility to make decisions versus have everything regulated. And so this is an ongoing discussion for us.
Okay. And similarly, I don't know that I wasn't able to discern what the caseload data is per DHS worker.
Oh.
Do we have that?
It's about the same, although I would say it's probably slightly lower because we've decreased the we have very few cases now that are held at DHS.
Mm-hmm. But could you give us those numbers?
So I would have to get those back to you. I don't have anything with me at this moment, but we would certainly get that for you.
Thank you very much. Now, and do you feel like we're making headway in decreasing the caseload of CUA workers? Are we in conversation with the different CUAs about what they actually need? Is it really just a matter of money?
I don't think it's a matter of money because we've been able to make the commitment to fund them fully. So it's not that's not an impediment. Both the state graciously and the city made the commitment to fund CUAs at the 1 to 10. But it really is around the recruitment and staffing effort. I know some of the CUAs have been very creative and have prioritized whether it's job fairs, recruitment efforts, and then other efforts around retention, because it's one thing to hire and bring on the right employee. We want folks obviously to stay and keep that education and that richness of experience on their caseload.
Mm-hmm. Okay. And then, like I said, I think there's a certain number of CUAs that are certainly at extremely low rates, and I think I would say that they may be doing okay, but it's the ones that are significantly above, like 50-60%, that it may be, rather than just aggregating an even median at 11.2, it's actually worth noting the ones that are significantly overloaded, how much overloaded are they, and whether, it's something where there needs to be a more direct discussion with that direct CUA about what additional supports can be given. Is there any relief that DHS can provide, and other types of things?
Yeah, and I think that we have very specifically provided the caseload breakdown that way so we can see where is our greatest challenge in terms of the number of cases that are carrying, because being able to look at who lives between 6 and 10 versus 11 or 13 is something we pay close attention to. We look at this on a regular basis.
Yeah. Absolutely. Thank you very much. You and I both share a commitment to reducing the number of children in out-of-home care. We know the statistics that in Philadelphia, 16.4 children out of 1,000 are removed from families compared to 5.5 out of 1,000 nationally. And of course, these out-of-home placements have a dramatic impact on families. They disproportionately affect Black families in particular. And I've been meeting with a number of the young people who are placed in some of the residential treatment facilities. So towards that, we've discussed the importance of bringing our kids back into Philadelphia.
Absolutely.
About doing better about placing them in kinship care. Can you talk a little bit more about why, what DHS is doing right now to reduce the number of young people in out-of-home care? care?
Sure. So I'll talk on a macro level, and I'm going to ask Deputy Commissioner Ali to talk a little bit about our front end, which we've really redefined. One is I'm very passionate about having less kids in congregate care setting, less kids overall in the system. We are at an all-time low, even when we've seen the fact that our numbers have not been able to reduce past 6,000, although we're very committed to trying to get below that number. We know the changes in the CPS law had a dramatic effect on the front end, meaning the hotline and investigation work. And so as a result, we have completely revamped what we look like as a department in terms of how our hotline investigations. So I'm going to have Kim talk about that. As it relates to congregate care, I'm pleased to say that we're at an all-time low. We're at 12%. We're below the national average, and the actual number of youth that are both in dependent and delinquent residential care has dropped pretty dramatically, but there's still more that we can do. And we are very committed to not, I would say, I think it was over 7 or 10 years ago, there was a significant effort to try to bring as many of our kids back into the state of Pennsylvania. And this administration is committed, as we've talked about with you, Councilwoman, is to have as many kids in Philadelphia County so that they're even closer to their community. But I'll ask Kim if she would just talk a little bit about what we've done on the front end so that we hopefully reduce the number of kids that are coming in.
So thank you for that question. In terms of the front end, we had to do an assessment because we knew that as a result of the Jerry Sandusky legislation, we saw a dramatic increase in the number of reports we received on our hotline, and then that translated into our investigations. So to give you a sense of the numbers, in FY2017, we saw 34,000 reports into our hotline, which translated into 21,000 investigations. And just to be frank, our investigative staff was overwhelmed. And in talking to the investigative staff, what we learned was some reports really did not necessarily need the heavy-handedness of Child Protective Services in their investigation. So we developed 3 units on our hotline that consisted of 3 social work service managers and 24 social work service, 3 social work supervisors and 24 social work service managers, so that we can do what is called a secondary screen out. So for any report that was a general protective service report, which are reports of neglect, lack of supervision, things of that nature, we actually deployed DHS social work service managers to take a second look and go make an assessment to their family's home. So as a result of that, we were able to reduce the number of reports that went into investigations. We started that in September of 2017. So from September 2017 up until now, we actually was able to divert over 48% of those reports. So they never made it to intake and investigations. So we're controlling the number of, want to control our population by looking at the front door as well as the back door. In terms of the back door around reduction, what we did in the fall of 2017 was what we call rapid permanency reviews. Any young person who had a permanency goal of reunification, adoption, or permanent legal custodianship, we took a special review of those young people. So we started with a pilot of 249 young people. Of those young people, we were able to move 43% to permanency within 5 months. And because we had that initial success, we did full rollout of the rapid permanency review started last month. So we believe that as a result of our front-end approach and our back-end approach, that we will begin to see the number of young people reduce in placement.
Okay. I have multiple questions, but I'll follow up after my...
Thank you, Councilwoman. Councilwoman Sanchez.
Good afternoon. Commissioner, I want to thank you. I know we had quite a few DHS public discussions around CUAs and other, and I want to thank you for always being willing to have the conversations. I also want to acknowledge how difficult I know the rollout of the report cards was, because people have a tendency to want you to tell us all what we want to hear, the good stuff, and I think the report card was a very good way of letting folks know that we had a lot of work to still do in the system. So I want to just acknowledge that, because this is not about what's wrong, but how do we make it better. So I appreciate that. There's always unintended consequences when we take on these major reform issues. One of the issues that I've brought up to you in the past, and I just want to put it on the record because I think it's something we got to keep an eye on, in light of some of the incidents, is the insurance costs related to it. How much in insurance are we spending, and what are some of the steps that you're going to take and we need the CUA folks to take to bring that cost down?
So I think as council might learn, I love homework assignments. And so first I want to thank you for your comments. We believe accountability is important, and so we were very transparent with the scorecard, and as I said, we've seen progress, and I think that's what we want. In regards to the liability insurance, I have to give tremendous credit to the CUA leadership. They have really taken this on as an issue to address at the state level, and so they have made significant progress with the state legislator, and there is a bill that's going to be introduced to the PA House Judiciary Committee in the next week that's looking at providing limits which would make them much more attractive clients to insurance providers, because it has limited who the CUAs can actually get a contract to be covered insurance-wise, just given the risk and liability. We're pleased that there are a number of sponsors to that bill that represent both sides of the aisle, which we think will help. We believe that it will likely pass and that we would be able to roll it out within 60 days of passage. So that could be a tremendous benefit, because absolutely it has been a financial impact on us, and Chris can provide you with the questions in terms about what that overall net change has been.
Yeah, of course. The increase between fiscal 17 and fiscal 18 was about $3.6 million. And that was just for 8 of our CUAs. So we're projecting an additional about $1.6 million in fiscal 19 that we don't have final quotes yet.
That's the total for all 10?
That's the total increase.
So
actually,
what's the total number?
I'll have to get back to you on that. I didn't bring it, but we can definitely send that to you.
Okay. Good, and so to the extent that this council could be helpful in lobbying the Pennsylvania delegation, as it relates to that, who are the prime sponsors of that right now?
So Representative Becky Corbin of Chester County is the primary sponsor.
Okay.
I can find out, I can get you the other names.
Yeah, I believe the mayor is hosting a state delegation Philadelphia council session tomorrow. So
Okay.
something to talk about.
Okay, we'd love to.
So that's important. Speak to me a little bit, and we went through this as the CUAs rolled out, the issue of the prevention strategy, in particular what you call your community-based prevention services component. Where are we in really articulating a broader strategy, not just out of school time? And the reason I bring that up, you and I had this conversation as we talk about prevention, gun violence, and others. You know, what is it that we really have? Because a lot of this money is in the portfolio of DHS. And do you think we got to have a better handle around the priorities with that pot of money?
So to start backwards, I would say that the answer is yes. We've gotten a much more better handle on where is it that this system needs to put its resources in order to truly prevent children from entering into the system or going further into the system. And so as a result, we've really narrowed down, and some of council members may have heard from folks, because we've taken some courageous steps to reduce in areas that we don't think are directly aligned with our priorities, and we've doubled down on areas that we think are critical. So just to highlight some of the work is, Deputy Commissioner Ali referenced that we changed our front end, so the diverting out of cases, we needed to make sure that there was a resource available. So Family Empowerment Services is a prevention service that's an in-home service that's delivered for families, that it's not an official except for service, but it's some of the sometimes economic, some of the well-being issues that sometimes present themselves to the department. We also do case management for pregnant women with substance abuse, or women who have an infant who was born testing positive to a substance. We also, of course, have the out-of-school time initiative. We fund parenting. We continue to fund support community outreach programs known as SCOP. We have partnered with our sister city department for our housing services. I mentioned the Achieving Independence Center. as well as truancy is another area that we fund through prevention.
Can you tell me what exactly are we doing around truancy and how that work is aligned with the school district?
So we have a number of truancy case management providers. We work with the district in terms of they identify children who have met the threshold. There was legislative changes, so now there is a burden on the district to demonstrate that they have done conferences with the parents, that they have been work to do an attendance plan with the family, at which point if that threshold is met, then the child gets referred to DHS in order to be looked at from a child welfare issue. During the course of our work with the district, then we make the referral to those prevention programs. Our intent is to try to make sure that the child doesn't continue to miss school, to try to avoid their further deepening and into the truancy system. That's something that we work very closely with the district, I can give you, I don't know if you want the number of providers, et cetera, but they're geographically.
I do think we need to figure out how we put together a directory similar to what you guys do in the summer around summer opportunities, around who are the providers, kind of in a district by district area. I think that would be helpful as we make referrals. And I'm particularly interested as it relates to the schools. How do we drill down on kids who are in the DHS system with their other provider networks?
So one of the things that we are not doing at the level, but we've been in conversation with the district, is how we do more case-specific data. It's not an easy data match. While we have an unprecedented data sharing agreement, the drilling down at a case level is a little harder, but we can, when a case-by-case issue comes up, we address it. But in terms of being able to give a CUA caseworker data that says, on your caseload, that's what we're trying to work towards. So we hope that the next time that we come back here, we can talk to you more about what that might look like, but we know it's a little bit of a heavy lift on both of our data teams, so we're trying to figure out how do we move from having access to making it work for the children.
The other thing is, so you're now on the CBH board.
Yes.
So talk to me about how are we going to better coordinate mental health services related to children and trauma, particularly under DHS?
So independent from my board membership, one of the
It can't be independent as one system. So.
Well, I'm saying that I'm a board member, but I'm also the commissioner of the Department of Human Services, and so CBH is one of our key partners. Mm-hmm. And so the head of that is Joan Ernie. She and I are in constant conversation and have done a lot to align our systems because we fund, obviously, similar providers. We meet on a monthly basis to talk about access. We talk on a regular basis in our teams, and I think much like the district, it's not just at the Joan and Cynthia level. It is definitely tiered into multiple layers so that if there is a case issue, there are multiple folks on Kim's team that work with folks on Joan's team to problem. What folks don't get to see day to day is we problem solve a lot around the stuff that doesn't necessarily bubble up. And so that is something that we feel really good about. We've also aligned around issues where we have challenging providers. So we're in constant communication around, hey, this happened, hey, are you aware of this? We actually get I think I may have mentioned this before, we get all notices of their intake closures, and likewise we provide that. We do visits to providers together where we're joint contractors, and so that's another way where we're trying to improve.
So given how difficult your report card was, how far away do you see CBH in getting to a place where they can have a similar report card about the quality of their providers?
That is a really interesting question to ask the commissioner of DHS to answer. What I can say is that we're really happy to work with them. It was a very difficult process for us. It took a year's worth of gathering data that was confirmed accurate data and then which to analyze. And so I'm confident that Joan and her team are looking around what is, and I know actually they've been looking at ways to do that work, and I'm sure she or David in subsequent testimony can provide more detail about that. But they've definitely started talking with us about what the methodology can look like.
So have there ever been a case where you've had to discontinue a child service provider within her system where that has worked cooperatively?
I'm sure there's an example. It was like out of the...
I want to know that
Yes,
it's
yes.
working, other than people talk to each other.
No, yes, absolutely. Yeah.
Absolutely. And as the commissioner indicated that she has meetings, and myself with Joan Ernie and her team monthly, I actually have a meeting with her, some of her clinical care managers at least every 2 weeks so that we can talk about young people and the services that they are receiving, particularly the young people who are placed in residential treatment facilities. We continue to keep our eyes on our young people that are in RTFs. So absolutely, if we feel that the care is not quality care for the young people, we will definitely discontinue the services and provide additional services to the young person.
That's what I want to hear. I know my time is up.
And I just want to
thank
say
you.
that my awesome team behind me just reminded me that we also have been doing a data match with CBH. And under the leadership of Eva, who really pushed all the city departments to say, we need to do better around how we share data among sister systems. We can now look at who's not getting their service. So if you're CBH eligible and you should be getting a service and there has been X number of days, that's something we're looking at and working with the CUAs on.
Thank you, Mr. Chair.
Okay, thank you, Councilwoman. Councilman Dom?
Thank you, Mr. Chairman, and good afternoon.
Good afternoon.
I have a few questions. Right now, you have 1,546 positions filled, but budgeted 1,814. So there's almost like 250 positions not filled. Do you think they're going to be filled in the next 12 months?
Councilman, she did answer that question earlier.
Oh, I missed that, sorry.
Yeah, that was my question, by the way. So it's a great question.
It's an excellent
Following
question.
your footsteps, yeah.
We could do it again if you want.
I'll find out. It's okay. Here's my next question then. DHS University went from 52 to 66. Can you tell me what that program is?
Sure. The Department of Human Services has DHS University, which is our training and technical assistance arm. So with the rollout of the scorecard, we invested more heavily on the technical assistance and training that we provide to the CUAs. And so part of the accountability for the community umbrella agencies is making sure that they have the supports and training that they need. So that's some of the enhancement that you saw in that area.
Okay. And then Juvenile Justice Services. We have, I think, the Youth Study Center. Did the employment go from 242 to 291, I think?
I'm sorry, the
numbers increased from 242 to 291 of the positions filled?
Yes, that's correct. So I'll start on the macro, and then I'm going to have Chris do the numbers. So one of the things that we experience as of 2016 is that we've seen an increase in the overall census of the youth that are staying at the juvenile justice facility. So for an example, I began in September of 2016, and the average daily census was between 80 to 90, and right now the average census is usually like 125 to 150. So part of this was making sure that we're appropriately staffed so that we can handle any of the one-to-one oversight, and just from a safety, there are licensing requirements that we have to meet.
So are you saying 120 to 150 of the number of people there?
Yeah, number of youth that are in the detention facility.
And so we have almost a 2-to-1 ratio of staff to youth?
Well, it's a detention facility, so there are a number of positions in that. That includes security, that includes cooks, that includes anything that it takes to house and operate that facility. It's a self-contained operation that the county runs.
But we added 49, I guess, new people at this location this year. Is that because of the increase in that population?
So the increase was based on the increase in the overall population.
Okay. Let me ask just a general question. For a young person who is having issues, is in your care, 14 years old, what do we pay typically for their schooling?
We don't pay for the schooling at all.
Who pays for the school district?
The School District of Philadelphia.
And my understanding is it costs like $50,000 or $60,000. Does that sound right?
That I don't believe that sounds right, but I don't have the exact number for you.
Okay. What does it cost DHS typically? Have you figured it out per child in our care, what we're paying?
So it varies on the level of service that they're in. There's some services that are much more intensive. There are some services where the child actually goes to their community-based school, so that you're not having to, the school district is not having to pay the education component. At the juvenile justice facility, the school district actually operates a school physically on site there, so there isn't any additional education costs outside of their having to run the operation. So Chris is happy to sort of break down some of the different levels of care, which then impact the per diem rate that we pay for.
I'm just looking for our budget versus the people under our care. I'm looking for that component of what is it costing us per person to provide services.
So I don't know that we have exactly what you're looking for, but we could drill down. Our most expensive service is congregate care, any kind of residential care. Only 12% of our youth are in that level of care, so certainly we've been able to drive that cost and service down. But I think based on what you want, I don't know that we have that exact, Chris can...
Maybe you can provide that to us. You don't have to give it to us today, but I'd like to know from your budget, the number of people in the programs, what is our cost per person typically?
Okay.
And the way I read the budget, correct me if I'm wrong, but your budget's roughly 15% funded by the general fund?
That's correct.
That's correct, yeah. And then I have just minor questions. On section 46, page 99, for example, I'm just trying to understand some of the suppliers, why the dramatic increases from 17 to 18. Maybe they were doing a good job and we increased them dramatically? So you have a few people that we were paying $1.6 million, and then it went to $6 million. You have a couple that were, one was $719,000, went to $5.8 million. One was $193,000, which is Wordsworth Academy, and it increased to $3.9 million, and we're budgeting $3.9. Is Wordsworth Academy the academy that had a few issues?
Yeah, so when these numbers were coming, so what we do, just so you know, in terms of getting the numbers for these specific contracts, which are our per diem contracts, is we take a look at our average days in care per month per provider and then multiply that out by the per diem, so we get a sense of what we think it'll be. It is almost never exactly what these numbers are, but the overall numbers usually come out about net to what we projected. In terms of Wordsworth Academy, the sort of recent legal issues hadn't been finalized when we submitted this budget, and so when we put it together, we didn't want to make any sort of assumptions about what that provider's name would be or anything.
But I want to confirm that Wordsworth Academy was terminated as of October 2016, so that wouldn't have, but the foster care contract is independent from the academy.
So that we still have to pay the $4 million?
Well, the overall there's about $300 million in the budget of per diems, and so we expect to be paying about that much out in fiscal 19.
Well, if that was terminated, why did Wordsworth go from $193,000 in 17 to $3.963 million in 18? This is page 101, section 46.
Yeah, that's based on utilization. That's mostly for foster care services.
What was it for?
That was based on prior year utilization, and it's mostly for foster care services.
Foster care, so we're still using them?
We're not using them, so they have dissolved as an entity, and that the case management as well as the foster care is under the direction of Turning Points for Children. So that contract, and the way our budget documents read is that often names and contracts in perpetuity sometimes stay beyond corrections or changes that have occurred.
The one right above them is called Woods Services. I don't know any of these companies, I'm just looking at the numbers. But we were paying them $719,000 in 17, and it went to $3.9 million. Is that because they're doing a good job, or what was the reason for that?
So one of the, to speak more broadly, another thing that we did that I should have mentioned earlier is that between fiscal 17 and 18, previously to the current fiscal year, most of our per diems were actually being subcontracted through our CUAs, and we brought that back in fiscal 18. So whereas in the past, those funds would have showed up on our 250 page as subcontracts through our CUAs, we've actually moved them back to 290 in the direct contracts with DHS now.
That answers about 50 of my questions.
Yeah,
then. Okay.
yeah.
Okay.
Sorry, that took me a minute to catch up on.
Okay.
All right, thank you. Thank you. Thank you, Mr.
Thank you, Councilman. Councilwoman Gibb.
Thank you very much. So one of the things that we left off talking a little bit about children being put in out-of-home placement, residential treatment facilities. I think one of the things that came out of the IOC report, the Improving Outcomes for Children, is the role that truancy has played around a lot of that. I think when we had our discussions around it, we all agreed around the table that we needed to do a lot more analysis about truancy and its kind of origins and how it relates to leading to out-of-home placement, because that's a pretty dramatic leap. Okay. So do you think that you can provide us with some background data showing how many kids who are put in dependency with truancy as the major driver of sorts? Can we peel back some of that? Are you working on that already? And can we send to you some questions about
You
how to
can
look
absolutely send questions. What I can say is that we don't have the data between the district and I to pull it out in the way I think the council wants to see it, so that whether or not truancy is the driver. We have some cases where the request for a placement is driven by truancy and other behavioral health issues or behavior issues related to that young person. And so I was speaking earlier that we're looking at with the district about how do we more meaningfully share data and what should we be capturing differently. So that is a commitment that we're making to this council body, as well as Councilwoman Gimm, I think you're aware that the legislative changes are pretty significant for the district, and trying to work to make sure that we can support them through that transaction, which I believe will result in less kids placed because of truancy, but that's that's something that we have to that we're having to work through with the district.
Yeah, I mean, I think that Act 138, does require schools to convene school attendance improvement conferences. I think we want to push the district to establish a homeschool liaison that can deal specifically with truancy that is based at the school rather than at a district level. All those things, I think, will help address student truancy before there's action taken with the family and before they come into, the venue of DHS. Now, I think some of the data that we've seen indicates that one of the main reasons for truancy is not, while some of it certainly is the personal needs of the child and home barriers, the number one reason has been school-based barriers to attendance. And so it seems critically important that if that's part of the issue, we need to really be focusing a lot on the schools, what their responsibility is, and really push DHS to force the district to have that school attendance improvement conference before, they begin interacting with the agency. Is that something that you make clear to them?
I can say this because these are hard conversations that we have, is that as we look at going forward, DHS has made it very clear that we don't expect to take any referrals unless we have evidence of that. And that's what Act 138 says, which is that it should not become a child welfare issue until you have exhausted the process that is to occur through the school district. Now, it's a lot for them to roll out, so we've been trying to figure out, this is a bit of a transition year for them. But yes, we couldn't agree more.
Yeah, and it's another reason why, as we said, if the barriers to school-based attendance, we're seeing that the young people who are coming into it, 1 in 4 are special needs students. We know that this is a serious issue that's happening with schools and with our young people. Some of them can be health-related, other types of things. So another reason why we wanted to establish nurses in schools, counselors in schools, and in particular social workers in placements in our schools, because it will all ease the burden that's coming back onto DHS. One other question that I had was about the Regional Truancy Court. So there's I believe over $10 million in contracts for CBOs that are working in the Regional Truancy Court system. It's not my understanding that system has been evaluated since it's been a while, maybe 2005 or so, but over a decade. Is there a plan to evaluate the efficacy of the Regional Truancy Court, whether that's the best structure to deal with the problems that we're seeing, given the emphasis on, given the impact that truancy has had on out-of-student placement? Some would argue that the Regional Truancy Court has not been a very effective method, but in either case, it feels like it's due for some type of evaluation.
Well, I I agree with you, Councilwoman. Anytime that the city is making a significant investment, it needs to be able to demonstrate whether or not that investment is one that is serving the purpose that it intended to serve. And you were correct. I think it's a number of years since it's been looked at. It was something that was created in Philadelphia really to address the volume of attendance issues that was occurring at the district level. My top of head response is that we're in a transition period in terms of what the attendance process and what that will look like for the district in terms of what they can do. And so subsequently, what is the best way for us to support them? And I believe we're still hammering that out. And so we are looking at the case management structure that we have now to make sure that make sure it's professionalized and supported in a way that it's serving an in-home purpose. But we're committed to doing that. I just think we need, in all honesty, some time for us to be clear what it looks like from the district end, and how do we then support them based on what we believe the new numbers might look like, et cetera.
Thank you.
Thank you. Thank you, Councilwoman. Councilman Green?
Thank you, Mr. Chair. Good afternoon. I just had some questions looking at the budget detail. I'm trying to get back to my numbers here and information. Looking on page 47 of your budget detail under Juvenile Justice Services, indicate there are a number of vendors to be determined for the Police Department Diversion Program. Can you give me some background? This looks like that entire section is to be determined in reference to how services will be provided. Can you provide some more detail?
So part of in general, to respond to the TBDs is when there's an RFP process in place that we're planning to do. I know for this particular fiscal year, we had asked the state for an expansion of the police diversion program to look at retail theft, in which case we'd have to expand the supports in terms of the contracts. We just received word about our state budget. We can have a whole nother conversation about the timeliness of our needs-based plan and budget. So we want to make sure that we hold those resources for when we're prepared to RFP out that. So we actually haven't. We currently, when a child is diverted, so year to date, there's 1,700 youth have been deferred from an arrest, and they go into what's called an intensive prevention services. Those are contract providers. So this was basically holding a chunk of money for the expansion to support the additional increase in youth that would be referred.
Okay. So you anticipate getting some additional state dollars in this regard that will be targeted to youth being diverted from certain offenses like a retail theft?
Exactly.
Or other type of maybe
low-level
conduct, low-level offenses that may engage in and be diverted to programs that help youth to not recidivate.
Correct. Exactly.
Okay. Gotcha. Okay. Thank you, Mr. Chair.
Thank you, Councilman. Councilman Don.
Thank you, Mr. Chairman. A couple of last few questions. Do you have an idea? I think last year you maybe mentioned there's about 6,000 children in the system. Do you know what that number is this year?
6,000.
Same?
Yes.
Okay. And adults, families, 2,000, still the same?
Of the 6,000, it makes up approximately?
Well, 6,000 is the number of children in placement. We have about 1,500 families who are receiving in-home services. So that is a decrease from the 2,000 that we had previously.
And I know very little about how this works, but if I was 14 years old and I couldn't stay with my parents, you placed me in a foster home, is there a compensation to the people or the parent, what does that compensation look like?
So actually, I will place you with kin. So I will place you with someone you know. Yes.
I saw that.
I'll find someone for you, Councilman.
It's at 56%, right?
Yes.
So let's say I'm in the 44.
So typically for general foster care, we pay the foster parent around $30 a day. And then we pay what's we pay for the administrative rate?
We are planning to increase it to $23 a day in fiscal 19.
You're paying how much right now, 30? 20?
So our payments,
Yep, go ahead.
our payments are split between a payment to the provider for providing, the home and certifying and doing training, and one to the parents. And the rate for the providers is currently $16.43. In our budget, we are increasing that to $23 a day. On the what goes to the foster parents, which we call the maintenance per diem, that really depends on the service, but generally, if you're under 13, right now that's $28.63 a day. If you are over 13, that's $38.63
Is that
a
in
day.
addition to the other, what's the total reimbursement for a parent who takes a child into their home? Total dollars?
It's that $28 or $38 dollar a day amount.
38 per day?
Yeah.
So is that like 13,000 a year, 14,000 a year, roughly?
Yeah, it's around there, yeah.
So if I took in 2 or 3 children at 13, 14,000, I'm making $40,000 a year?
Correct.
But I'm providing their food and their care. How about
Yeah.
their medical? Who provides the medical?
So PADHS provides the medical. So foster parents and kinship care parents do not have to pay for medical insurance for young people in their care.
Okay.
And just to reiterate, the payments to the resource parents, so the foster or the kinship care parents, is for the care of the young person. So what we say at the department when we are asked questions is that foster parents do it out of love. They do not get paid. The payments go to the care of the young person.
Right. And how often does someone from DHS will visit me? How often will they come and see me?
So the visits are done by the community umbrella agency case manager, and they're done at least monthly.
Monthly?
To the
So
home.
Once a month, I would expect to see somebody from DHS?
Yes.
Okay, thank you very much. Just curious how that worked. Thank you very much. Thank you. Thank you, Mr. Chairman.
Thank you. Thank you, Councilman. Councilwoman Reynolds Brown.
I pay close attention to the truancy discussion because that's been an unresolved service that we have yet to figure out as a government. And so, is that a fair assessment?
That's a fair assessment.
Okay. So, with that said, you mentioned that you're in transition and you're meeting with the partners period. Does that mean you're seeking to ultimately create a framework so that the truancy office or the truancy function or the truancy the tracking of, the prevention of, can have some real, a beginning and end to it? I mean, we were discussing this during the street administration.
So,
Okay.
so to talk about the transition piece, I think it's important that the major changes impact the school district of Philadelphia in terms of their obligations, and so which subsequently changes the system that we've had in place, which needs to be revisited. And so what I was suggesting is that we're still finalizing what that looks like for the school district, and then ultimately how it impacts us in terms of how we have to respond. But looking at the framework is definitely something that we have to make a priority.
So what's the methodology for that? Is there a task force with partners at the table where you're examining what hasn't worked so you can figure out what could work? How's that?
I think we have the right partners. Our greatest challenge is we still have to continue to serve while we're planning, right?
Okay.
So you're still delivering a service that has to exist because we have to meet legal and court obligations related to this process. So I can't dismantle something until the new something is very clear. And so I think trying to juggle, this is what we're doing right now and what we're going to be doing in the future. So, we definitely welcome an open discussion. It is a big issue that impacts a number of areas, but it's something that I would include the school district in sort of determining who should be, who would be best at the table.
Yeah, we're losing young people along the way. So is family court at the table?
So we are very much engaged with Family Court. They're one of DHS's key partners, yes.
Okay, so that's not the answer to my question.
Yes.
Is family court at the table in a constructive way where you are doing a group think to figure out how we can get this right?
I think we have not yet engaged them at a level because the court has to remain somewhat neutral. There's information presented to them.
Okay.
They're a judicial body.
Got it.
It's our responsibility and obligation to present the best efforts and the best resources available for the judges to make a determination.
Okay.
So I think we have to walk that line in terms of
Carefully.
carefully, so we get feedback around what is critical for them and what do they need from us.
Okay.
But there's certainly people that could come along with us in that process.
Okay, so maybe there's a role for us to help you with that offline.
Thank you,
What's the
Councilman.
trigger for the school district to call DHS and say, we think we have a family in distress, we need DHS engagement?
So they have to pass a threshold of a certain number of days. So their initial start of what they have to do around an attendance plan has to come after 3 unexcused absences. Once they get to 10 unexcused absences is where there is a lot of work that's supposed to have had happen. So this conference, they're supposed to develop an attendance plan. When that hasn't worked or there's evidence that that plan hasn't worked, that is when the trigger happens for DHS to be involved.
I see. Okay, thank you.
Thank you.
Thank you, Mr. Chairman.
Thank you, Councilwoman. Councilwoman Sanchez.
Thank you. I want to keep the conversation going as it relates to schools. So we have different parts of our government working within the schools. We have the community schools piece. We have a very robust contract with the school district to keep facilities open. Can you talk to me about at what point do we make the connectivity? You know, I look at this challenge with keeping school buildings open at night, particularly in areas where we need after school time and other things. What role, if any, have you played in there? And as we connect the points around prevention, you know, how do we make sure that if you have a program or a service that you're or paying rent into the district for time, how do we connect those pieces, right? I think this notion that we got to pay the school district money to keep our building open is a little challenging for communities to understand.
So the city has definitely recognized the excellent point that you have made, which is that there are a lot of different touch points and there's a lot of operational work happening between the city and the school district. And so I'm pleased to report, and I am part of this table, is that through the managing director, we meet operationally with key leadership at the district, and those are working meetings to talk about how do you enhance all these different pieces, because there's so many people working on certain initiatives that it's hard to keep track of what are all the different things that are going on. So that's something that started more recently. Our first discussion was very much focused on the out of school time, and how do we enhance that was understood both from the facilities operational piece all the way to the programming, access it, and support. So I just want to share that that's a promising practice that has recently evolved in terms of the coordination of the efforts.
There's a lot of inequity in who has access to school facilities. It's a conversation I have had with the Parks and Rec Department as someone who led the charge for our ability to have access in our sports programming, a lot of it youth-oriented, very volunteer-driven kind of initiatives. I like to see more connectivity around out-of-school time as it relates to some of that. And I like it to be driven from a perspective of, again, the school district's coming to us for more money, and obviously we want to be as supportive, but I feel like that's still kind of missing, right? The fact that I have a community school that can't be open at night is like, how many adults in a room does it take? I have people who need access to those gyms. I have people who need access to those fields. And I don't want to get through this budget process because, when we did the last contract and we negotiated all of those access points, I assumed that there would be equity in distribution, and there hasn't been. And so now I want to be a little bit more intentional in that, if the school district's going to come ask us for more money, I want all the community schools to be part of that, right? That needs to happen ASAP. And then the high need areas, because again, the schools that are being open right now are not the ones with our high needs area, right? It's because people need access to gyms and all the other stuff. We need to be able to explain that in a more equitable way. And I think that there's opportunities for a lot of prevention services stuff that DHS could be working along. And that, until that connection point happens, I just don't think it's going to be there. So I'm going to be following that before we finish this budget cycle to make sure that we have that. People should be able to count on their neighborhood school, and particularly the community school, as an access point and as a resource point, right? Because we haven't even begun to talk about going back to adult education stuff that used to happen. We used to have adult education stuff in the barrio. We don't have it anymore, right? Community college used to do some stuff. And I just feel like 10 years ago, where we were under Mayor Street and where we are now around that robust services and small-based providers, granted, in the middle, we lost a lot of money, but we need to go. There was a reason why we had that, right? There was choice, right? Choice for children, choice for adults. And I really want to see us work to go there. So, again, because it all ties into your prevention money. Can you provide for us a more descriptive, and you can provide it to the chair later, of where you are investing in out-of-school time prevention services, and then what you see as gaps, right? Again, Council President Clark and others have been talking about violence and gun violence. I'm very encouraged to hear you talk about some services around parents, women who are pregnant, but if you could share that so we can look at it as we kind of recycle. And then lastly, because I'm going to let you go, I know we want to keep moving on, really just want to thank you for your proactiveness around some of the Puerto Rico case management support, and how important that has been. I say that on a day where Puerto Rico's gone dark again, and that worries me, because I think we were sending a message: people need to stay home, stay in Puerto Rico, and now they're dark, so we may get another influx of folks coming in if stability is not restored there. But I really appreciate the work around that.
Thank you. I think it was hard to hear. I just wanted, for a moment of privilege, just to say that how traumatizing to have electricity restored, and those who did have it, to lose it even temporarily is really disheartening. But
if you saw the videos of when lights went on, when schools got lights, and the kids applauding, I mean, talk about trauma. Is like water, electricity.
Yeah. I think to tie that into DHS's commitment to the city and to this administration is to make sure that we invest in the areas that we think are more critical. The Puerto Rican evacuees was a no-brainer for DHS, so we were happy to do that. In regards to OST, you are right in how we think about it. So we look both through by councilmatic district, we look at schools of need, we work in partnership with the district as well as our providers and the rec department to determine where can we best support. So we know how many out-of-school time programs operate by district. The answer around not necessarily what gap is, but there is the need to invest from all the way from preschool through 12th grade. So the mayor's commitment on the pre-K has been a critical cornerstone for the start. And then our commitment jumps in when you start from 1st to 12th. And there have been, priorities that have moved over the years. Let's focus on the little ones. No, let's focus on middle school. Let's focus on high school. And we need to look at those across the board and not choose one over the other. So we have to make sure that the right slots exist equitably in ways where there's greatest need. And that means we have to pay attention to the older youth, because we can't just focus on the front end. Middle school is critical. I will tell you, the middle school is some of the hardest programming, because it either ties into a sibling, but the interest issues are very different. On the high school, it's often about exposure, areas of interest, et cetera. So those are all things that we've been working on at a citywide level to make sure that our resources are invested in the best manner possible.
Okay, so you'll forward that list kind of by district and slots.
I have it by district and I have it by council. Yeah.
All right, thank you.
Thank you. Thank you, Councilwoman. Thank you all very much. Thank you for all the work you do.
Thank you, Council. Thank you.
For being here today.
Thank you.